Today we will discuss on how to score a ventilated patient and what it actually matters. If your patient who is ventilated, looks stable, has a good SpO2 and acceptable ABG, you think the patient is stable. But if you are not scoring the patient, you are missing deterioration in real time. Mechanical ventilation is not just about oxygenation. It is about lung stress, it is about lung strain. Injurious ventilation occurs when high tidal volumes are there. We know the volley trauma, when high pressures are set, or when we know the barotrauma, or repeated collapse, the atelector trauma. Clinical scoring systems help to quantify this. Oxygenation failure, lung compliance and severity, and also sedation and ventilator interaction. They convert physiology into actionable items and numbers. So the most important scoring tool is the PF ratio, which is the PaO2 by FiO2 used in the ARDS Berlin criteria. 200 to 300 is mild, 100 to 200 is moderate, and less than 100 is severe. Driving pressure is the second parameter, which is equal to plateau minus peak pressure. It's a strong predictor of mortality in many studies. So target a driving pressure of less than 15 centimeters of water. This reflects lung stress better than the tidal volume alone. Next is the RAS score, which is a sedation score, which will be between +2 and -5. Target a score of 0 to -2 in most ICU patients. This avoids over-sedation and delirium. Next is compliance, which is tidal volume by driving pressure. Low compliance means stiff lung and severe disease and poor outcome. So a patient may have an acceptable PF ratio but high driving pressure. This means that oxygenation is looking okay, but ventilation-induced lung injury risk is high and is happening in this patient. This is commonly missed in the routine ICU practice. At the bedside, remember the three numbers that you check: PF ratio, driving pressure, and the RAS. If all three are optimized, oxygenation is optimized, lung stress is minimized, and patient ventilator synchrony is achieved. This is a well-managed ventilated patient. So in mechanical ventilation, don't just ventilate, quantify, track, and protect the lung.